This solution is used to prevent rabies infection in people who have been exposed to the virus through a bite or non-bite wound by an infected animal. It is made from healthy human blood that contains high levels of antibodies to fight the rabies virus. It is important to take this medication as directed by your healthcare provider. The dosage and timing will depend on the individual situation and should be determined by a medical professional. This medication is given by direct injection into the area of the wound, such as a bite or non-bite, by a healthcare professional. The rest of the dose is given by injection into a muscle by a healthcare professional. It is important to receive this medication as soon as possible after exposure to rabies. Waiting too long after being exposed may decrease the effectiveness of the medication. Your doctor may also recommend vaccination after receiving this medication. The dosage is determined based on your medical condition and weight. Talk to your doctor about the best treatment plan for you. Some common side effects of rabies immune globulin, PF, 150 units/ml intramuscular solution include redness, pain, or tenderness at the injection site, as well as nausea, vomiting, diarrhea, dizziness, tiredness, headache, or back/joint pain. If any of these effects last or get worse, make sure to speak with your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While many people using this medication do not experience serious side effects, it's important to be aware of any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help right away. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects not listed, make sure to contact your doctor or pharmacist promptly. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before receiving rabies immune globulin, it's important to let your doctor know if you have any allergies to this product or other immune globulin products. This medication may contain inactive ingredients that could cause allergic reactions, so make sure to talk to your pharmacist for more details. Before using this medication, it's important to inform your doctor about your medical history, especially if you have a certain immune system problem or if you have a history of vaccinations or immunizations. Rabies immune globulin may make you feel dizzy, and consuming alcohol or marijuana can exacerbate this effect. It's important to avoid driving or using machinery until you can do it safely, and limit your alcohol intake. If you use marijuana, make sure to talk to your doctor about it. This medication is made from human blood, and even though the blood is carefully tested, there is a very small chance that you may get infections from the medication. It's important to consult your doctor or pharmacist for more information on this. If you have recently had or are planning to have any immunizations or vaccinations, it's important to inform your doctor. This medication may prevent a good response to certain live viral vaccines, so your doctor may need to test your response or have you vaccinated again later. Your doctor will also instruct you on the best time to receive these vaccines in order to get a good response. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of drug interactions, as they can affect how your medications work and increase your risk for serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This medication may interfere with certain lab tests, such as Combs test, which could potentially cause false test results. It's important to inform all lab personnel, as well as your doctors and pharmacists, that you are using this medication. If someone has taken too much rabies immune globulin, PF, 150 units/ml intramuscular solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 for emergency assistance or contact your local poison control center at 1-800-222-1222. For Canadian residents, reaching out to a provincial poison control center is the best course of action. During your treatment with rabies immune globulin, your doctor may need to perform certain lab or medical tests to monitor the levels of antibodies in your blood. It is important to attend all scheduled lab appointments and consult your doctor for any further information. Intramuscular injection is generally preferred over subcutaneous administration, particularly for rabies immune globulin, RIG. The gluteal region is the preferred site for RIG administration in adults and older children. When the gluteal region is contraindicated, such as in patients with bleeding disorders or those receiving anticoagulant therapy, the deltoid region may be used. In infants and small children, the anterolateral aspect of the thigh is the preferred site for RIG administration. This medication is not meant to be used at home, as it is administered in a hospital or doctor's office. There is no need to store it at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.